Under the needle, where acupuncture meets anatomy. Today, we're exploring large intestine 11, one of the most commonly used points in clinical practice. Large intestine 11 is located at the lateral end of the cubital crease, midway between the lateral epicondyle of the humerus and the biceps tendon when the elbow is flexed. Palpation typically places this point over the proximal portion of the extensor mass of the forearm. This region is clinically important in patients presenting with lateral elbow pain, repetitive gripping injuries, and overuse syndromes. Beneath large intestine 11 lies the common extensor origin, particularly the extensor carpi radialis brevis and portions of the extensor digitorum. These muscles originate from the lateral epicondyle and play a central role in wrist extension and grip stabilization. The deep branch of the radial nerve, originating primarily from the C6 and C7 spinal segments, travels through this region before entering the supinator muscle. The radial recurrent artery also courses nearby, supplying the lateral elbow structures and contributing to the vascular network around the joint. Understanding these anatomical relationships helps guide safe needling and clarifies why this point is so clinically effective in lateral elbow conditions. Clinically, large intestine 11 is commonly used for lateral elbow pain, particularly in conditions such as lateral epicondylitis, commonly referred to as tennis elbow. Overuse of the wrist extensors can create microtrauma at the common extensor tendon, leading to localized pain and reduced grip strength. Because this point overlies the extensor mass and radial nerve distribution, stimulation here may influence both muscular tension and neural signaling. Integrating this point with proper rehabilitation of the forearm extensors can improve outcomes in chronic elbow pain syndromes. From a traditional perspective, large intestine is known for clearing heat and regulating qi and blood along the large intestine channel. Additionally, it is used for elbow pain, inflammatory conditions, and systemic heat-related disorders. From a modern anatomical perspective, this region directly influences the extensor mass of the forearm, particularly the extensor carpi radialis brevis. Due to its close proximity to branches of the radial nerve, it is also responsible for motor and sensory signaling in the lateral forearm. When these perspectives are combined, large intestine 11 becomes both a local mechanical intervention and a broader regulatory point within the upper limb. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.